Great.
Hi everyone, thank you very much for joining us. This is the 6th of 6 webinars for the Driving Health Project in the webinar series. So the Driving Health Project that Elizabeth will tell us a little bit more about in a moment has been going for 2.5 years now. And what we've really tried to do with these webinars is put together bite-sized snippets of the findings of our research, because we've published 8 reports so far. They are mammoth reports, so it's really important to put it into sort of digestible chunks. All the information that you'll hear about today is available at the Driving Health website, which is drivinghealth.net. There will be a chance at the end of, towards the end of the presentation today to ask questions. So if you do have a question, please either use the question and answer button or the chat function that's at the bottom of the screen on Zoom. Usually we have about 10 or 15 minutes towards the end of the webinar where we can actually go through questions and respond to them. So please, if you have questions, put them in there. I'll monitor those while Elizabeth is giving the webinar, and we'll go from there. So I'll introduce Dr. Elizabeth Pritchard. Elizabeth has led several components of the Driving Health study. She has led the interviews with drivers, so in-depth speaking with drivers, and also the development of the intervention component that you'll hear a bit about later. Dr. Pritchard is a research fellow in the Insurance Work and Health Group here at Monash. So not only has she led those components, but she's had significant input to every single part of the Driving Health study. So without further ado, I hope I haven't missed anything. Let me know if I haven't. So if I have, but I'll hand over to Elizabeth, and yeah, good luck.
Thank you. Wonderful. So let me share the screen and we'll get underway with today's topic. And I love it how Zoom hides things as you go. Right, so our topic today is driving through fatigue. So as Ross said, this is part of a 3-year study that we're part of, and I'm part of the team. So Ross is leading the team, and there's a number of us involved in creating these webinars so that you can have these little chunks of digestible information rather than get overloaded with all the hoo-ha of academic responses and study language. So the Driving Health, as we said, is a study, is a 3-year partnership with research partners like Linfox, the New South Wales Centre for Work Health and Safety, and the Transport Workers Union. And it's been supported also by National Health and Medical Research Council Partnership Project Scheme. So to our knowledge, this is the largest Australian-based study focused on the health and well-being of Australian truck drivers. There's a lot of research that's been coming out of North America and Europe, for example, but we believe it's really critical to have that evidence base that represents Australian drivers working in Australian conditions. So the Driving Health study has examined multiple sources of information over the last 2 and a bit years to inform our findings. And some of this comes from existing sources, like 120,000 accepted claims for workers' compensation. And some of it is from data sources which we've used for the first time. For example, 3,500 death benefit claims from the largest industry superannuation fund for workers in transport. And we've also generated some new data over the last 2 and a bit years, with some 1,400 drivers completing an online survey for truck drivers, with follow-up telephone interviews with 332 people, and also in-depth interviews, as Ross said, that I led with drivers and also family members. And so to date, we've got the clearest picture that we can have around driving health and the clearest picture of Australian truck drivers. So one of the top concerns that arose for truck drivers is fatigue. And so today we're going to explore this data in a little bit more detail that we received to understand more about the influences of fatigue and what could potentially lower their levels of fatigue that they experience while on the road as well. So we'll just describe fatigue a little bit more as we've described it in some of our reports, that there's a mental and physical side to it. So there's a mental and physical state of extreme tiredness and lack of energy. And it includes words like sleepiness, tiredness, drowsiness, and exhaustion, which are often used interchangeably. So fatigue is obviously a huge concern, particularly if you're driving a 50 or 60-ton truck. And if you experience fatigue, you're likely to have lapses in concentration, near misses, or at the highest end of the risk continuum, traffic crashes. So we therefore need to understand more about fatigue and how drivers notice that they feel fatigued or not, and what were the specific factors that impacted fatigue from the analysis that we gleaned from the telephone interviews in particular. We are also concerned about the risk of fatigue and how this impacts on mental health and physical well-being. And as you can see here, we have a self-reported level of fatigue that was part of the questions that they answered. So the level of risk of fatigue was defined by one question: how often do you become fatigued while driving for work? And this was measured on a 5-point, what's called a Likert scale, 0 to 4. So those people who identified 0 or 1, which is never fatigued or less than once a month, they were put in the low risk category. And those that were 2, 3, or 4, which is monthly, weekly, or daily, or almost daily, were categorized in the high risk category. So when asked how often do you become fatigued at work, these are the figures that showed up. 44% of the respondents answered either daily or weekly, with the highest levels reported in the under 35 years age group. And I'll come into that a little bit more on the next slide, with 53% reporting feeling fatigued at work. So that's quite concerning. And when we looked at the high level of risk of having fatigue, we see that 38% is in the low range, and over 62% of drivers reported having fatigue in the high level range. And that high level range was, remember, weekly, daily, almost daily, or monthly. So the extended hours of concentration, the waiting times, the adverse weather conditions on the road, the state of their home life, relationships, connections, isolation, as I mentioned, and the way the driver was respected on the road by other motorists, how they were treated by managers, were all part of what played a factor within their level of fatigue risk. In the in-depth interviews, one driver talked about how he knew he needed to have a break, but didn't feel empowered to. And this is a quote from one of the drivers. Then I'd be driving and I knew I should have been taking a break, but I knew I had to be somewhere. And I still remember that old bravado attitude. I didn't pull up. I didn't want to be like a sissy and ring up my boss and say, look, I've got to have my 7-hour break now. I'm not going to make it. So you didn't feel brave enough, even within the legislation or the fact that it would protect you to be able to do that. So this is quite concerning as well. It's like the pressures and demands, external pressures to meet deadlines and timelines also play a factor. One family member stated that their level of fatigue is high because of the amount of concentration that's involved being out there on the road. It's the mental fatigue. Another family member talked about the strain, the brain strain. There's a lot of brain strain because you've got all the other traffic on the road to contend with. And I think because of the long hours, it's just really tiring. They probably don't get much sleep either. So how does fatigue look across the age groups that we saw from the research and from the data that we received? So this gives you a wee snapshot. If you look at the yellow and the grey, they're the ones that are in the higher risk category. And so you can see that the younger ones became more fatigued than the older ones, which is interesting. And we'll talk a little bit more about that as we go through. Interesting to note that also there's a type of training that was completed by drivers in order to help combat fatigue. So basic level fatigue management was completed with just over half of the drivers, no accreditation in a third of them, advanced fatigue management in just over 7%. However, it's important to think about, remember the factors and the numbers for the high risk people of reporting fatigue was over 62%. So even though we're still doing occupational health and safety, fatigue management trainings, and half of them, not all of them, there's still a high level of fatigue being reported on a daily, weekly, or monthly basis. So we asked also, did the drivers use stimulants or medications to combat fatigue? And this was their response. 95 drivers in all reported that using a substance to help combat fatigue in the last year was something that they had done. Nearly 57% had used caffeine or energy drinks, and a very small proportion used stimulants like amphetamines or other stimulant medication. So that was only at 3% and 1.5%. In the in-depth interviews, drivers talked about using all types of over-the-counter stimulants, or some even bought from overseas and had them posted to them in the past. So they were behaviours that they had done in the past. However, in the last 5 to 10 years, the ones who were using those types of stimulants in the past said that they no longer use those for several reasons. One was health reasons, one was also the amount of drug testing that was happening in the industry. And they were pleased that it wasn't happening now. However, one person also stated that it was like, I'd rather have somebody who was on some sort of stimulant and awake than really drowsy and sleepy and driving erratically coming towards me. So when we put all this information into a specific analysis program to do a regression analysis to identify what the other factors were that impacted fatigue from a statistical perspective, the following emerged as significant factors. So as we would expect, those working more than a 41-hour week had higher risk of fatigue. However, those working above 60 hours, and there were a few of them, did not. So we think that maybe there was just not enough in that cohort, because it was a very small percentage of people who were working over 60 hours. But those working between 41 and 60 had a higher level of risk of fatigue. Regulations and rule-breaking behaviours. So the regulations in relation to was around those who broke the regulations, for example, like driving over a lot of times, exceeding speed limits, taking shorter breaks, those types of things. And it's interesting to think about, did the fatigue create the rule breaking, or did the rule breaking happen because of the fatigue? Which way around was it? And we don't actually have that data to explore that in detail, because our data was like a one-off snapshot, and we just know that it was associated with rule breaking behaviours and higher levels of risk of fatigue. Having between 4 and 6 task conditions increased levels of occupational health and safety vulnerability. So this is about things like, do you manually lift or carry or push things heavier than 20 kgs more than 10 times a day, those types of things. So when they had more of those demands upon them physically, we also saw that there was a higher level of risk with fatigue. As expected, poor sleep was associated with a higher risk of fatigue as well. Now, sleep was self-reported, and it was based on 3 questions from a validated tool that was used. And having trouble sleeping occurred 0 to 1 nights for nearly half of the drivers. So they had trouble sleeping, falling asleep. However, 21%, nearly 22% of drivers reported problems 5 to 7 nights a week. So we're looking at over 60% of drivers saying they're having difficulties with sleep, poor sleep, either getting to sleep or staying asleep, or the length of time they were sleeping. And drivers also reported that they fell asleep unintentionally during the day, on average around 2.3 days a week in the last month. And over 11% reported nodding off or falling asleep while driving at the wheel. Nearly 17% of participants were defined in the high risk area of fatigue around poor sleep. So that's almost 1 in 5. Loneliness was also an interesting one. And those who experienced loneliness or identified that they were lonely on the road on their own were at higher risk of more fatigue. And from the in-depth interviews, we had some interesting contrasts with that as well. Some of the drivers were saying how they loved to be on the road. That was their space, that was their time. They had time to think, they had time to actually be them. And others went, I just hate the isolation. It's really difficult, particularly if there's no phone coverage, or we're not allowed to make phone calls to family during the day because of some of the company rules. So there was a whole continuum around that as well. And then we looked at specific factors that were associated with lower risk of fatigue. And there was 3 that came up, those being under 45 years of age, which I mentioned earlier, were less likely to be fatigued. And in relation to some of the reasoning around that, we're not quite sure. Maybe they're staying up later, don't know. Maybe it is that those people who are 45 years and over, some of them, a lot of them had children, so maybe they're used to broken sleep, maybe they develop better coping mechanisms for broken sleep, and maybe, as some studies suggest, as we age, we may not need quite as much sleep. So it's an interesting point to recognise in relation to fatigue. The second factor is workplace environment, and a sample of this is experiencing discomfort from mechanical vibration in the truck, that sort of the mechanics of the truck and the road, through to experiencing verbal abuse, violence in the workplace, either from the public or from management or other members in the workplace. So this was the whole of environment. So when that environment was really good and really supportive, then there was lower risk of fatigue. And also, and we don't want to promote this too much as being a public health service, those who were smokers had less fatigue. So we don't want to promote that one as a solution going forward. But it was interesting also to note that in relation to the number of people who were smokers, who were drivers, were very similar to the population of Australia. However, it was extremely low in relation when we compared it to other countries, for example, like the USA, where there's over something like 60-something% of truck drivers who are smokers, and in New Zealand, in Australia, it's over 20%. So what are some of the possible solutions that sort of emerged from some of this research? We can look at things that are a real complex, multi-pronged approach, and it really needs to happen. That our study revealed the complexity of factors impacting driver physical and mental health, and how that impacts on their driving performance as well. So to maintain and improve the longevity of the trucking workforce, we need to think about programs and interventions that look at these types of things. What are the scheduling and hours? Can we be flexible on that? How can we give people notice about what's happening long term? Could we do split weeks, 4 and 3 days, rather than 5 and 1, or 6 and 2, whatever, it's 5 and 2, 6 and 1. We need to look at the whole access to healthy foods and truck stops, the opportunity for physical exercise, which is the culmination of the other webinars that we've been producing and talking about this week as well. How can we look at increasing health checks, both physically and also mental health wise? How can we support people? How can we destigmatize that whole, as that driver talked about, the male macho bravado attitude? How can we destigmatize asking for help and create the space going forward so that we can do that? How can we look at better sleeping facilities, more shade in parking areas, more bays, and areas that drivers know that they can get to within their timeframes, even if there's roadworks or delays on the road? And encouraging connection with others through radio or phone to counteract the loneliness. So as there's many factors identified that are out of the control of the drivers, this reinforces that we absolutely need to consider a multi-pronged approach to increase the health and well-being of drivers in Australia. And so to that end, we have created from this research the Driving Health Allocator training program. Now, this is a 15 to 20 minute online program that can be done by allocators, supervisors, line managers, or that level of people who work with drivers, and they can access this on their phone, on the computer, on the iPad, and can be done in 20 minutes. Now we're testing this and trialing this in October. It's just about completed. We're just about there with the completion of this. And this is a culmination of the amazing quotes that have come through from many of the drivers and their family members. And we've created this program to assist allocators, supervisors, and line managers to identify the factors that they can help influence as well. Because just like the drivers, there's lots of things outside of their control. There's a whole lot of things that are within the control of allocators, supervisors, and line managers that can help support the health and well-being of drivers. And I think it's really important for us just to remember things like this. Another quote from somebody that they really want to self-manage. I can personally tell when I've been driving along, they're struggling to keep within my lane and just struggling to stay awake, and there's nowhere to pull over. Or you've got another 15 minutes to get to where you're unloading and you're out of time altogether and you can't move for another 8 or 10 hours. Again, you can't just pull up in the middle of traffic. So that absolute stress of just staying and just trying to stay awake is huge. So we need to address this in some way and think about how can we do this and how can we support the drivers in their health and well-being in the workplace. Because if we are supporting them in different ways and supporting drivers to be healthy and stay healthy at work, then we're going to keep the wheels turning, we're going to keep the industry going, and we're going to be able to continue with that whole flow-on effect of companies making money, turning the wheels, keeping the wheels going, and doing what we need to keep Australia going. So thank you for being part of this Driving Through Fatigue webinar. Any more information that you are requiring will be on the drivinghealth.net website. We have 8 reports that are in there. Lovely, big, huge reports that you can get your teeth into with all the details and data in there. You can also contact us on info@drivinghealth.net if you have a specific question. That would be awesome. And we have the program available, which Ross has put in. So please register for this program, the training program that I talked about for allocators, line managers, and supervisors. The training program is for you. We're creating it for you to make your job easier and to help create even more health for drivers going forward. So we've got time for questions.
Thank you very much, Elizabeth. Yes, I have the link to to register for the training program is in the chat there. Everything, all the reports, everything about the study is available on drivinghealth.net. I've got a question for you, Elizabeth. I was wondering if you had, someone else's question has come through before I get lots of time to ask questions. So I'll ask Saki's, the HSW team from Cameron's. Was there any connection between fatigue and medical conditions?
Not that came out on top that I'm aware of. I'm just putting my head back into the actual graphs that came through with all the other data in it. Nothing, it was not significant. So we may think it would be significant if you've got sort of diabetes or a heart condition or asthma or something like that. We may think it would be quite significant in relation to fatigue. However, it didn't come out statistically significant at all. And I think some of those things are some of the anecdotes that people were talking about was like, oh, I've managed that forever. That's not an issue. I just managed that. It's this. And so they were talking about the traffic and the way they were treated and the concentration that they had on the road.
Yes, so it just seems that other factors just seem to be much more important than those health conditions when it comes to fatigue. We know that health conditions have really important impacts for other outcomes, health, mental health, but also some other factors of driving performance. But apparently not for fatigue. I just wanted to read this out from Sharon, because it fits. These sessions have been really interesting. Having short sessions has also been great to manage screen fatigue. Yeah. So thanks, Sharon. We're glad we're able to cut down screen fatigue. And Madeleine has said systems focused rather than on the individual driver. Really great stuff. I hate that one because that's something that's really come through strongly to us as conducting this research, that the driver is just one part of quite a big system, and a lot is focused on the driver and what they can absorb. And I think what our data has really told us is that drivers are at their limit. They can't absorb anymore. And while it is important to prepare them for what they need to do in the job, it certainly seems to me that it's really important to actually change how the job operates so they don't have to absorb so much. So Lisa Meigs has said, these sessions have been great. Are you going to present your outcomes to government at any level, as some of these issues, such as the parking bays, are in their control?
Yes. Well, I'll just say Ross has actually been invited onto the inquiry, so I'll let him talk about his, we pulled together a submission, and Ross actually did a verbal submission as well.
Yes, so we presented the driving health information to the inquiry into the sustainability of the transport industry. That was led by Senator Glenn Stirl. And in the report, there's been a number of recommendations that have been made, and absolutely some of those factors are recommendations in that report. So we've done as much as we can to give it to government, and the driving health research actually features quite strongly in that report. Unfortunately, our most recent report, the telephone interviews that we've been talking about, wasn't ready going into that inquiry, but yeah, we're still here. We're still shouting it to the rooftops to anyone who will listen. I think there's lots of positive feedback on the chat here, Elizabeth. So thank you.
There is. I'm just reading it. It's wonderful. Thank you. Can I just? There's a question from Greg. Greg, I'm not quite sure what you mean by outside work hours that are permitted in Australia. Are you talking about the downtime, the rest time? Because I do know that some, if you can clarify in the thing, that would be great. Your question was, I'm just wondering if you have an opinion around the outside work times that are permitted in Australia and how they contrast to bulk of the research, which tells us that fatigue occurs much easier. Much easier.
So Greg says, I meant the maximum work hours permitted, sort of 12 hours, 14 hours.
Oh, right. Yes. Yes. It was really interesting because drivers were saying when you feel fatigued, you're already too fatigued. And so I had a couple of quotes. I'm not sure if I've got it right here. I'm just having a look. They had a couple of quotes that mentioned that it's like, by the time you feel tired, it's too late. You've already lost concentration and you should be off the road. And some of them were saying, I used to manage my fatigue much better. I used to stop every 3 hours. And now they encourage you to work, to drive for 5 and then have your 15 or 30-minute break. I think it's 30-minute break after 5 hours. And what he used to do was drive for 2.5 or 3 hours and then have a 15-minute break and then keep driving and 15-minute break and manage it like that. But here's a wonderful quote as well. It's like, in my opinion, like WA, where you run your own fatigue, because different states do it differently as well. I know that I've had enough, and it's as simple as that. No doctor, no professional, no one can tell me when I've had enough. I know myself when I've had enough driving and I need to go to bed. And it's as simple as that. And I think that's awesome, because it's like, yeah, we say you drive for this, you sleep for this. And the other quotes have talked about how I drive when I'm tired and I sleep when I'm awake because of the logbook, and it's just not working. And so there was a lot of narrative around that, but we haven't got the specifics in the telephone survey that I'm aware of.
One last question, Elizabeth. I'm just keeping an eye on the time.
Yes.
So was there any difference between drivers on day shift or night shift reported? And was there a difference between male and female drivers?
Male and female drivers, there was only I think it was 2.4% were female drivers. And so it was too small a sample to actually compare with male drivers specifically. We can have a look at that data and see if it's in the report 8. So you could potentially have a look there. the first part of that question was night.
Day shift or night shift?
Again, that didn't, a day and night shift. We just looked at long haul and short haul. So we didn't specifically look at day and night shifts to compare. So it was short haul and long haul, and that was 500 Ks more than or less than. And so some people who did short haul did it overnight, were on the night mail deliveries. Some people in the long haul were day night, sort of split over, midday over evening. And so we weren't able to compare that specifically. The people who I interviewed, they did talk about how the night shift was really tough. One person was on permanent nights, and it was like, how do you expect people not to be fatigued? It's night. Everybody else is going to bed. I'm driving, and I'm here for another 10 hours.
Well, thank you very much, Elizabeth. Thank you, everyone, too, for the positive feedback about the webinar series online, saying that they've been fantastic. We really appreciate that feedback. We've really tried hard to sort of put it into small, digestible chunks. That's helping with screen fatigue. Certainly helps with brain fatigue for me a bit as well. But like we've said, all the reports are available on Driving Health, all the recordings of the webinars. So if you've missed one of the webinars, they'll be available on drivinghealth.net as well, resource page. And we'd really encourage you to please sign up for the free training package. And when we say sign up, all it means is we'll let you know when it's available and ready to use. And we'd really encourage you to encourage those that you work with, the people in your company and other companies, to spend the 20 minutes. Again, we're taking that same approach. We're not trying to overwhelm anyone. We're actually trying to make sure that it's short, sharp and high quality, impactful training that can be provided in that time to really raise the awareness of the things that allocators and those who work with drivers can do that will actually help the drivers to be healthy and stay healthy at work. So to sign up for that, please join the link. You can also, so the link's in the chat box. Please also visit drivinghealth.net. If you have any questions, please don't hesitate to contact us at info@drivinghealth.net. We're an approachable bunch. We like to think we are. Questions. If you've got information or research that you're aware of that perhaps we haven't been able to answer some of the questions you've had, by all means, please send it to us. We're happy to promote any other research in this space that's all about helping drivers to be healthy and stay healthy at work. But thank you, everyone, for joining these webinar series. We hope you've enjoyed them. And if you've missed one or two along the way, please catch up and tell others about them if they haven't had a chance to see, because we really want to spread the word about how we can really help drivers who are, they keep Australia moving. So we need to keep them moving and keep them healthy at work.
Yes.
So
Fantastic. Thank you so much from me too. And yes, put it out there all over your Twitter feeds, your Facebook, your Instagram, your LinkedIn, whatever, in your company newsletters. Let people know about it. That would be fantastic, because we're wanting to really have an impact in the industry from this 3 years of research. Thank you so much for being part of this.
Thank you.